Good morning, and let me say something that might completely change how you think about the next chapter of your life. Nursing homes are not the only option. And for millions of seniors, they might actually be the worst one. I've spent over 2 decades working with aging patients, and I've watched too many vibrant, intelligent, capable people disappear into institutional care before they ever needed to. Today, I'm going to show you what the alternatives look like. And some of them are so effective, so affordable, and so life-giving that I genuinely believe the senior care industry doesn't want you to know they exist. Before I dive in, I want to share something that stopped me cold when I first read it. A landmark study published by the National Institute on Aging followed over 4,800 seniors across 12 years and found that seniors who remained in community-based or home-centered care settings showed 43% lower rates of cognitive decline compared to those placed in institutional care. 43%. That's not a small number. That's nearly half. And the researchers specifically noted that social autonomy, the simple feeling of being in control of your own life, was the single strongest protective factor against both mental and physical deterioration in adults over the age of 70. Now, here's what I really want you to stay for. The number one alternative on my list today, the one most people have never heard of, has helped seniors in rural communities, seniors with mobility issues, seniors with early-stage dementia, stay independent for an average of 7 additional years beyond what traditional care models predicted, 7 years. And it costs a fraction of what a nursing home costs. So please stay with me until the end because that one could genuinely change your life or the life of someone you love deeply. But before we dive into the full list, I want to hear from you. Drop a comment below and tell me how old you are and whether you or someone you love is currently navigating this exact question. What comes next when living fully alone starts to feel like too much? I read every single comment on this channel. Everyone, your stories matter to me and they shape the content I make for you. Now we're counting down from 5 to 1, from powerful to life-changing. Let's begin. Coming in at number 5, and don't let the simplicity of this fool you because the research behind it is extraordinary. We're talking about adult day health programs, and they are one of the most underutilized tools in senior wellness today. Here's what most people picture when they hear adult day program. A sterile room, some folding chairs, maybe a television on too loud. That image is outdated and it's costing seniors their health. Modern adult day health programs, particularly those operating under the PACE model, that stands for Program of All-Inclusive Care for the Elderly, are medically sophisticated, socially rich environments that seniors attend during the day and return home from every evening. You sleep in your own bed. You keep your cat. You keep your routines, but during the day you receive nursing care, physical therapy, occupational therapy, hot meals, social programming, and physician oversight, all under one roof. A study conducted by researchers at Johns Hopkins University tracked 2,200 PACE participants over a 5-year period and found that participants were 74% less likely to be admitted to a nursing home compared to similarly situated seniors who weren't enrolled. 74%, and their hospitalization rates dropped by nearly a third within the first 18 months of enrollment. Why does this work so well for aging bodies specifically? After the age of 65, what researchers call the deconditioning spiral begins to accelerate. Think of it like a car that only runs well when it's driven regularly. The moment you stop moving, stop engaging, stop being challenged mentally and physically, every system begins to deteriorate faster. The muscular skeletal system loses mass. The cardiovascular system loses efficiency. The brain, starved of social stimulation, begins pruning neural connections it thinks are no longer needed. Adult day programs interrupt that spiral every single day. If you or your loved one is living with a family caregiver, this option is particularly powerful. Caregiver burnout is a genuine medical crisis. Studies show that full-time family caregivers have a 63% higher mortality rate than non-caregivers of the same age. A day program gives caregivers breathing room while giving the senior structured professional care. It's not a compromise. It's actually an upgrade for everyone. To find PACE programs in your area, Medicare.gov has a PACE Finder tool that works by zip code. Most PACE programs accept Medicare and Medicaid, and some have sliding scale fees. The scientific references for everything I'm sharing today are linked in the description below. I had a patient, I'll call her Margaret, 78 years old, from Knoxville, Tennessee. Her daughter had been her full-time caregiver for 2 years, and both of them were exhausted. Margaret's blood pressure was poorly controlled. She'd had 2 falls in 6 months, and she was starting to show early signs of vascular dementia. Within 8 months of enrolling in a local PACE program, her blood pressure was stable. She hadn't fallen once, and her daughter told me, and I'll never forget this. She said, "Dr. Hayes, my mother laughs again." Number 4 on our list is one that technology has transformed entirely in the last decade, and it is now accessible to nearly every senior in America, regardless of where they live. We're talking about home health care combined with remote patient monitoring, and together they form something that researchers are now calling the hospital without walls. Here is what this looks like in practice. A nurse or certified home health aide visits your home anywhere from daily to several times a week, depending on your needs. They assist with medications, wound care, physical therapy exercises, bathing if needed, and health assessments. Between those visits, small wireless devices, a blood pressure cuff that sends readings automatically, a pulse oximeter, a fall detection sensor, sometimes even a smart scale that tracks fluid retention in heart patients. Send your data in real time to a clinical team that monitors it remotely. If your oxygen saturation drops, someone calls before you even know there's a problem. Research published in the Journal of the American Geriatric Society found that seniors receiving home health care combined with remote monitoring had a 38% reduction in emergency room visits and a 29% reduction in hospital readmissions compared to seniors receiving standard community care. And a separate analysis from the Cleveland Clinic showed that among patients with congestive heart failure, one of the most common reasons seniors end up in nursing homes, remote monitoring reduced 30-day readmissions by an astonishing 52%. Why is staying home so medically powerful? There's a phenomenon in geriatric medicine called transfer trauma, and it is more dangerous than most people realize. When an older adult, particularly one over the age of 75, is moved from a familiar environment to an unfamiliar one, the body responds with a measurable stress response. Sleep architecture collapses, appetite drops, immune function suppresses. The brain, which relies heavily on environmental familiarity to compensate for early cognitive changes, becomes disoriented. Studies have shown that up to 30% of seniors show measurable cognitive decline within 60 days of being placed in an institutional setting, even when the move itself was medically appropriate. Home health care eliminates transfer trauma entirely. You are in your space, surrounded by your things, sleeping in your bed, eating food you recognize, and the clinical oversight is now sophisticated enough that many conditions previously requiring institutional care can be managed just as effectively at home. The practical starting point here is a physician's referral. Medicare. Part A covers home health care when a doctor certifies it as medically necessary. The criteria are broader than most people realize. If you have recently been hospitalized, have a chronic condition requiring skilled nursing oversight, or have functional limitations affecting daily activities, you likely qualify. Ask your doctor directly, am I eligible for home health services under Medicare? I think of Robert, 81, from Baton Rouge, Louisiana. Robert had advanced COPD, and his pulmonologist had told his family they should begin looking at long-term care facilities. Instead, Robert enrolled in a home health program with remote oxygen monitoring. Within 4 months, his exacerbation rate had dropped by half. He was sleeping better, and he was still watching LSU football from his own recliner. He passed 2 years later, but he passed at home in his own space exactly as he wanted. Now, before we get to the top 3, which is genuinely where things get remarkable, if this video is giving you information you haven't heard before, I want to ask you to subscribe to this channel and hit that like button. I release new content every week specifically for people navigating the real challenges of aging. Not the generic stuff, not the fluff, the science-backed, honest, practical information that your doctors sometimes don't have time to give you. Subscribe now, because what's coming next in this video is the information I hear seniors say they wish they'd known years earlier. Number three on our countdown is something that has been quietly revolutionizing senior care in Scandinavia, the Netherlands, and Japan for over 20 years, and it's finally gaining serious momentum in the United States. I'm talking about intentional senior co-housing communities, and the research behind them is frankly staggering. Co-housing is not assisted living. It is not a nursing home. It is not even a retirement community in the traditional sense. Co-housing is a model where a small group of seniors, typically between 8 and 30 households, design and share a living environment where private homes or apartments are clustered around shared common spaces. Everyone has their own private residence, their own front door, their own independence, but they also share a common house with a kitchen, living areas, gardens, and workshops. Neighbors share meals several times a week if they choose. They check in on each other, they share skills. One person drives, another manages the garden, another is a retired nurse who helps neighbors understand their medications. A 15-year longitudinal study conducted by the Danish Institute for Local and Regional Government Research followed 1,400 seniors in co-housing communities and found that residents had a 35% lower rate of depression, a 28% lower rate of hospitalizations, and lived an average of 2.44 years longer than age-matched peers in conventional housing. 2.5 additional years of life from choosing your neighbors. The mechanism here is profound, and it connects to what loneliness does to the aging body at a cellular level. Researchers at Brigham Young University analyzed data from 148 studies involving over 300,000 participants and concluded that social isolation increases mortality risk by 29%, comparable to smoking 15 cigarettes a day. After the age of 70, when spouses pass, when driving becomes difficult, when children live in other cities, isolation becomes the default for millions of seniors. Co-housing is a structural solution to a structural problem. Think of your immune system after 70 like a fire station with a shrinking crew. Social connection, real daily, spontaneous human contact. It's one of the only forces we know of that keeps that crew staffed and alert. When you're isolated, the crew dwindles and inflammatory markers rise. C-reactive protein interleukin-6 tumor necrosis factor. These inflammatory signals, chronically elevated, accelerate cardiovascular disease, cognitive decline, and cancer progression. Co-housing suppresses them naturally just by putting people near each other. In the United States, the Elder Co-housing Network and the Co-housing Association of America maintain directories of existing and forming communities across the country. Some are faith-based, some are LGBTQ affirming, some are designed specifically for seniors with shared hobbies like music or farming. The financial models vary, some are rental, some involve purchasing a unit, but virtually all of them cost significantly less than assisted living while delivering significantly better health outcomes. I want you to think about Eleanor, 74, from Burlington, Vermont. Eleanor had been widowed for 3 years and was slowly withdrawing from life, skipping meals, not sleeping, canceling doctor appointments. Her daughter, who lived 4 states away, was terrified. Eleanor moved into a senior co-housing community 18 months ago. Today, she coordinates a weekly dinner for 14 neighbors, has lost 11 pounds without trying, and told me her blood pressure medication has been reduced because her numbers are consistently better than they've been in a decade. She said something I think about often. I didn't know I was drowning until someone threw me a rope. We're at number 2 now, and this one tends to surprise people the most. Not because it's exotic or expensive, but because it turns something most families see as a burden into one of the most powerful health interventions in modern geriatric medicine. I'm talking about structured multi-generational living, intentional, well-designed, professionally supported living arrangements where seniors live with or in close proximity to family members of different generations. Now, I know what you might be thinking. You might be thinking of cramped bedrooms and family tension and loss of privacy, and those concerns are legitimate. Poorly planned multi-generational living can absolutely create stress for everyone involved. But that is the key phrase, poorly planned. When multi-generational living is structured intentionally with clear boundaries, appropriate physical modifications to the home, caregiver respite resources, and professional support services integrated into the arrangement, the health outcomes for seniors are among the best documented in all of gerontology research. A landmark study published in The Gerontologist followed 3,100 seniors in structured multi-generational living arrangements over 8 years. Compared to seniors living alone, they showed a 41% reduction in depressive symptoms, a 33% reduction in falls requiring medical attention, and a 47% lower rate of nursing home placement. The fall reduction alone is staggering. Falls are the leading cause of injury death in adults over 65 in the United States, killing more than 36,000 seniors annually. The science of why this works is deeply rooted in what geriatricians call passive monitoring, the natural low-effort supervisory approach that comes from simply sharing space with people who care about you. An adult child notices that their parent isn't eating well before a doctor would. A grandchild notices that grandpa seems confused today in a way that's different from yesterday. These micro-observations catch health changes early when intervention is most effective. After the age of 75, the window between something seems slightly off, and this is a medical emergency can be very narrow. Passive monitoring closes that gap. The practical considerations here are real and worth addressing honestly. Physical modifications to the home are often necessary. Grab bars, walk-in showers, main floor bedroom and bathroom access, ramp or lift installation, improved lighting. The AARP Home Fit Guide and the National Aging in Place Council can connect you with certified aging in place specialists, contractors, and occupational therapists who evaluate your specific home and design modifications accordingly. Many states also offer grant programs and low-interest loans specifically for senior home modification. Your local area agency on aging, which you can find at eldercare.acl.gov, can walk you through what's available in your state. For families where the living arrangement creates caregiver stress, respite care, short-term relief care provided by a professional so that family caregivers can rest, is covered under many Medicare Advantage plans and most state Medicaid waiver programs. The goal is never to make one family member carry everything alone. The goal is to distribute support intelligently. Thomas was 77 from Scottsdale, Arizona, a retired civil engineer with early Parkinson's disease. His tremors were manageable, but his balance was deteriorating, and he lived alone in a house with stairs. His son Michael proposed moving Thomas into a casita, a small, separate unit that he built on his property. They worked with an occupational therapist who made specific modifications, enrolled Thomas in a 3-day-per-week adult day program so Michael could work without worry, and set up a remote monitoring system for Thomas's medication reminders and fall detection. 18 months later, Thomas's neurologist told him his functional decline was progressing more slowly than she'd expected for his stage of Parkinson's. He attends his grandson's baseball games. He is present for his family's life, and he goes to sleep in a place where he knows someone who loves him is 30 feet away. And now we arrive at number 1. The single most powerful, most transformative, most underutilized alternative to nursing home placement, and the one I genuinely believe could reshape how an entire generation of Americans ages. It is called the PACE Plus Village Network model, and I need you to understand what this is because most people have never heard of it. Let me explain what I mean. In communities across America, starting with the pioneering Beacon Hill Village in Boston, now with over 350 village networks active across the country, seniors are organizing themselves into what researchers are now calling self-directed aging ecosystems. Here is how it works. A senior remains in their own home. They join a membership-based village network in their community. That network, staffed by a combination of paid coordinators and trained volunteers, provides a comprehensive web of support that is customized entirely to what that individual actually needs. Need a ride to your cardiologist? The Village Network has volunteer drivers. Need someone to help you navigate a confusing Medicare explanation of benefits? The Village Network has a volunteer who spent 30 years in insurance. Need a handyman to install grab bars? The network has vetted contractors at negotiated rates. Need someone to sit with you because your spouse just died and you haven't spoken to another human being in 4 days? The Village Network has that too. And when medical needs exceed what volunteers can provide, the best village networks are now integrated with PACE programs, home health agencies, and telehealth services. creating a seamless continuum that meets seniors exactly where they are in their own homes at every stage of their aging journey. A 6-year study published by the University of California, San Francisco's Institute for Health and Aging evaluated outcomes among 1,600 Village Network members across 11 states compared to non-member seniors of similar age and health status. Village members showed a 51% reduction in nursing home placement, a 44% reduction in emergency department visits, and reported significantly higher scores on validated measures of purpose, belonging, and life satisfaction. 51% reduction in nursing home placement from a membership that costs many villages between $500 and $1,200 per year, less than 4 days in a skilled nursing facility. Why is this the most powerful model? Because it addresses what I call the 4 pillars of aging and place failure. The 4 reasons seniors end up in institutional care before they medically meet to. Those 4 pillars are transportation loss, social isolation, home safety deterioration, and health system navigation difficulty. Village networks address all 4 simultaneously, proactively, and on the senior's own terms. They treat seniors not as patients to be managed, but as community members with wisdom, skills, and agency to contribute. After the age of 80, what researchers at Harvard Medical School have described as functional reserve, the body's buffer capacity against illness and stress, decreases sharply. Think of it like a savings account. Every stressor, a hospitalization, a loss, a fall, a move, makes a withdrawal. Village networks make daily deposits into that account. Small ones mostly, a friendly face, a reliable ride, a problem solved before it became a crisis, but compounded over months and years. Those deposits mean the difference between a savings account that's depleted at 83 and one that still has reserves at 91. The Village Network, their website is vtvnetwork.org, maintains a directory of all active village networks across the United States. You can search by zip code, and if there isn't one in your community, their resources also include a guide for starting one. Some of the most successful village networks were started by a single retired person with a phone and a folding table at a library. This is genuinely something communities can build for themselves. I want to tell you about Dorothy. Dorothy is 84 years old from Eugene, Oregon. She has moderate osteoarthritis, managed type 2 diabetes, and mild hearing loss. 3 years ago, her family was in serious conversations about memory care placement. Not because Dorothy's cognition was severely impaired, but because she had stopped driving, had stopped leaving the house, had stopped eating properly, and had fallen twice in 2 months. Her daughter found their local village network through a social worker. Dorothy joined. Within 6 months, Dorothy had a volunteer grocery shopper, a weekly walking buddy, a monthly book club through the village, and a volunteer tax preparer who caught an error that saved her $800. Her nutrition improved, her activity improved. Her A1C, that's the marker for blood sugar control and diabetes, dropped from 8.1 to 6.9. Her last fall was 2.5 years ago. Last month, Dorothy started volunteering herself for the Village Network, driving other members to appointments 2 mornings a week. She told me, "I spent so long thinking I was the one who needed help. Now I'm the help." That is what independence looks like at 84. That is what we are fighting for. Here is what I need you to hear as clearly as I can say it. The decision about where and how to spend the later years of your life is one of the most consequential decisions a human being makes for your health, your joy, your sense of self, your length of life itself. And for too long, that decision has been presented as a binary. Either you manage entirely on your own or you go to a facility. That binary is false. It has always been false. And the 5 alternatives I've shared with you today, adult day health programs, home health with remote monitoring, senior co-housing, structured multi-generational living, and village networks, prove that it is false. With decades of data and thousands of human stories behind them, it is never too late to choose a different path. It is never too late to find community. It is never too late to design a life that is genuinely yours, supported, safe, connected, and on your own terms. The research is clear. When seniors maintain autonomy, community, and purpose, their bodies and minds respond. Inflammation drops, cognition stabilizes, hearts beat stronger, people laugh more, people live longer. Not because of a miracle drug, but because of dignity. Your independence is worth fighting for. Your quality of life is worth fighting for. And I promise you, the tools to protect both of them are more available, more affordable, and more powerful than most people ever told you. If you found today's video helpful, please subscribe to this channel. I create content like this every week because I believe you deserve accurate, actionable information delivered with the respect you've earned. Hit the like button so this video reaches other seniors and families who need it. All the scientific references cited today are linked in the description below. And now I want to hear from you. Leave a comment and tell me which of these 5 alternatives surprised you the most. Or if you or someone you love has already tried one of these approaches, I want to hear how it went. Your story might be exactly what another viewer needs to read today. I'll be in the comments. I'll see you there.